Breast cancer survivors sometimes notice cognitive problems like a decline in their memory, attention, and multitasking abilities after completing chemotherapy treatment. It's often known as or called chemo brain. It can be really frustrating and serious. And now the IU School of Medicine is looking for volunteers to take part in a study to try to research and learn more about it. Joining me live this morning is Dr. Brenna McDonald. She is the professor of radiology and imaging sciences. Dr. McDonald, thank you for joining us this morning.
Good morning. Thank you so much for having me.
And this is fascinating. You're so welcome. This is a large clinical trial, I understand. Tell me what you guys are hoping to learn here.
Well, we've been working in this area for quite a long time. This study is actually funded by the National Cancer Institute. My colleague Rob Ferguson at the University of Pittsburgh and I have been working on looking at therapies to try and help cancer patients with these problems over the years. And as you said, we got funding to do this large trial here and in Pittsburgh to test a couple of treatments and see if they can really help with these concerns.
Oh, that sounds great. Now, who is eligible to participate here?
So we're interested in this study in recruiting patients who have had chemotherapy for breast cancer within the past 5 years. And we have some brief screening measures that we do over the phone just to make sure patients are eligible. But then that's really the major criteria, is having had chemotherapy treatment within the past 5 years for breast cancer.
What will they have to do? That's always my question. If somebody's, asking me to do something, okay, can I do it from home? Do I have to go someplace? How many times a week, months, or a year? What do you want people to know?
Exactly. And the great thing about this study is almost everything can be done from home.
Oh, excellent.
Yeah, it's wonderful. So this study is designed, the therapy that we're doing is once a week for about 45 minutes for about 8 weeks. And that can be done over the phone. So if you have a smartphone or a device you can connect to the internet, you can do the therapy with a clinical psychologist over the phone. The study assessments are also done over the phone or the internet. The only thing that would require coming in person is an optional component where we're also doing MRI scans of the brain to look at what changes in the brain we see if these treatments are helpful. And that you would come in 2 times for before treatment and again about 8 weeks later after treatment. But I said that's an optional component of the study. Everything else can be done from your home.
That's great news. I would think that you would get people to want to help, and then they could probably learn a lot about themselves too during the study and talking with somebody for an hour. Can you quickly too tell us what some of these examples of these cognitive problems, what are you seeing in patients?
So most commonly what patients tell us are, they might have trouble multitasking or learning new information as fast as they used to be able to, or completing tasks as quickly. And as you can imagine, in daily life or at work, those things can be really frustrating if you feel like you're just not functioning at your best. And our hope is that the therapies in the study can help improve those problems or help patients learn strategies for compensating or sort of dealing with those challenges.
Dr. McDonald, thank you. We're going to put up the information to get more people into this study. We sure do appreciate all the work you're doing to try to help those people that are dealing with so much.
Great. Thank you so much. I really appreciate it.
You're welcome. If you'd like to learn more about this study, perhaps take part in it, fox59.com/links.